Dr. Ferguson coming to you from the Passioncam. We've been doing a series on Alzheimer's disease, and this is one in the series. So if you're catching this and it doesn't fit totally, you might want to go back to number 1 in the series, because there's multiple episodes here. They can stand independent, but they'll probably stand better if you listen to them one after the other. We've been talking about Alzheimer's disease, and now we're talking about things that can mimic Alzheimer's disease that may confuse one. And the easiest one to distinguish, or to, I don't say the easiest, that might not be the right wording, but one of the ones that can be very significant challenge to distinguish from Alzheimer's disease might be depression, but you can do it. And say the person's 80 years old, they're majorly depressed, and if you just look at them, if you talk to them, they have the signs and symptoms of Alzheimer's disease. Characteristic of Alzheimer's disease is you lose short-term memory first, and then you begin to lose long-term memory. Whereas the demented patient that's 80 may not have lost any memory. And if you push them to come up with things, they may come up with them. Now, both of those people may be able to come up with what happened at their kid's wedding anniversary, or what happened 20 years ago. They both may be able to come up with that, because that's long-term memory. But short-term memory is, what did you have for breakfast? What did you have last night for dinner? Did you do something that they might normally do on a daily basis? That's short-term memory. And that the demented patient with Alzheimer's disease will many times not be able to come up with, particularly if they're beyond the initial stages of Alzheimer's disease. Where the person that has depression, they can probably come up with that if you push them to come up with that. And that's one of the ways that you can distinguish the difference between those two. And if you begin to treat the depression, hopefully those signs and symptoms that appear to be Alzheimer's disease will go away, and that person will begin to function normally again. Many times, as a person is getting older, you may hear a person say, I've got part-timer's disease, or I got senile dementia, or I'm getting real forgetful. Well, getting older does not mean you get dementia. As I told you in one of the earlier episodes, that at age 85, 40 to 50% of the adult population in the U.S. may have Alzheimer's disease, but the other 50% doesn't. So that other 50% still can function and do things as they always did, but they may do it a little slower. They may come up with the answer a little slower. They may not pop it out just as quickly as they used to, maybe moving slower, functioning slower, but they can usually still do it. Whereas the Alzheimer's patient, they still won't be able to do it, even though, slow doesn't come into the picture. They just can't do it. And when you're thinking your loved one has Alzheimer's disease or dementia of any type, by all means, I would encourage you to see your healthcare provider so that they can do an assessment and evaluate them and see if indeed they do. And the earlier you start treatment, if a person has Alzheimer's disease, the more success you have, or the better success you have. Because largely what happens with the treatment of Alzheimer's disease is you slow down the progression of the disease process. You don't really change the end point, but you slow down the progression, and they keep their faculties longer. So on that note, Dr. Ferguson coming to you from the Passioncam. We'll talk more next time. We'll continue to talk about Alzheimer's disease. Be blessed. Bye-bye.